Hi Adrian, how are you doing today?
Hello, I'm doing good.
I'm glad to hear that. Before we get started today, I just want to thank you so much for being here and taking the time in your schedule to come in today. I know it can be hard. Today, we're just going to go through a few questions that will help both of us understand and evaluate your readiness to quit your tobacco use. How does this sound to you?
Sounds good.
Great. Do you currently use any tobacco products? This could be things such as cigarettes, e-cigarettes, vape, hookah, or smokeless tobacco.
I currently smoke cigarettes.
Thank you for sharing that with me, Adrian. And how many cigarettes would you say you smoke on a daily basis?
Probably around 10.
Thank you for sharing that information with me, Adrian. And how long have you been smoking or using tobacco products?
Probably about 3 years now.
All right, thank you so much for letting me know that. And within those 3 years, have you ever tried to quit? And if you have, what tricks or methods did you use?
I tried to quit once 2 years ago. I was able to quit for about 3 months, but then I started again.
That's amazing, Adrian. Quitting for 3 months is something to be very proud of. Thank you for sharing that information with me, Adrian. And what made you decide to quit before, and what tricks or methods did you use?
Well, I know smoking isn't good, and I know it can affect my health, so I wanted to quit to change my lifestyle. I honestly quit cold turkey, but after 3 months, I could no longer fight the urge to pick up a cigarette.
All right. Again, quitting for 3 months is something to be very proud of. I gather that you understand the effects tobacco has on your health, and being able to quit for 3 months again is something to be very proud of. What would be your reasoning for quitting your tobacco use right now if you decide to do so?
I do plan on quitting, even though it's hard, just to maintain a better lifestyle and good habits.
That's amazing. Being able to recognize that tobacco can significantly affect your health is a great reason for quitting. Quitting will also improve your oral health. Being here today is a step in the right direction and shows you are very interested in quitting your tobacco use.
I mean, yeah, I never thought of it like that before.
With this being said, is it okay if I go over the effects tobacco has on our oral health and our systemic health with you?
Yes.
Perfect. So, before we get started, I'm just going to go over how tobacco use and smoking affects our oral health and our systemic health. So here I just have a fact sheet, and in this picture, you can see this is what somebody who does use tobacco, what their mouth would look like, okay? And nicotine is the main psychoactive ingredient in tobacco that makes it addictive. It is considered toxic, and 60 milligrams can cause fatality. It also affects the integrity of our teeth by causing staining and can lead to oral cancer. As you can see here in this picture, she does have some staining. Nicotine directly absorbs in the oral mucous membranes. It has systemic effects such as cancer, respiratory disease, cardiovascular disease, pregnancy, infant health, and other conditions such as immune function. Some side effects of tobacco use can be cancer, periodontal disease, soft tissue problems, heart tissue problems, and can also increase our caries risk, which just means put us at a higher risk for cavities. All right, and I'm just going to give this to you at the end of our appointment so you can take it home with you, okay? And then also I'm going to go over what tobacco cessation is and why it's important. So what tobacco cessation is just dental hygienists using a program to support a client's journey on quitting smoking, and we use things such as motivational interviewing and using the 5 A's to help us assess and for also you to help evaluate your readiness to quit your tobacco use. All right, thank you for listening. And so now I'm just going to pass you over a mirror, okay? And then in the mirror, let me know what you see. You may be able to see things such as redness, maybe inflammation around your gum line, and maybe some staining. Do you notice any of these things?
I see staining.
As your dental hygienist, I strongly advise you to stop your tobacco use as it can significantly improve both your oral health and your systemic health. Smoking also increases the risk of oral cancer, gum disease, increases your risk for cavities, increases risk for teeth stain, and bad breath. Where do you stand right now on quitting your tobacco use?
Probably a 6.
A 6 is great. Why a 6 and not a 2?
Well, because I do really want to quit, and I think it is possible after talking to you, but it is hard. All my friends around me always do it, and I think I will be tempted.
Thank you for sharing that with me. So what I gather is that you realize tobacco has harmful effects on our health, and you think it'll be difficult for you to quit because your friends smoke and you feel like you'll be tempted to smoke too.
Yes, exactly.
All right. And do you plan on quitting within the next 6 months?
I would say so.
Amazing. It sounds like you're in the contemplation stage, meaning you're thinking about quitting tobacco use in 6 months. Quitting smoking is very difficult, but are you in the right direction? Would you be interested in hearing some of the resources for quitting your tobacco use?
Yes, that would be great.
Perfect. So some resources being nicotine patches being anywhere from $30 to $40, and then as well as nicotine gum being anywhere from $20 to $30, and they have different strengths and dosages available depending on your individual needs. The patches are placed between the lips and the gums, and it's absorbed through the tissues in our mouths. Then some dosages that come from the nicotine patches are 3 to 4 milligrams per pouch, and this can also vary depending on the brand. We also have the gum that is also over the counter and is chewed like regular gum, but you need to chew it a few times to start feeling the nicotine sensation in your mouth. As well as it is noted that it takes about 30 minutes for the sensation to go away. The average dosages contain 2 to 4 milligrams per gum.
Yes, I've heard about the gum. That one interests me the most.
That's amazing to hear. Thank you for letting me share these options with you. Now that I have given you some of the over-the-counter resources, is it okay if I share with you some pharmacologic resources that are also commonly used to quit tobacco use?
Yes, please.
All right, perfect. So some prescription medications include Zyban, that usually comes in 150 milligrams, taken once daily at the beginning of your treatment, and then after 4 days, it'll be taken twice daily. And the treatment will usually last up until 12 weeks, depending on the client's needs. And then Champix is taken once daily at 0.5 milligrams, and then after 4 days, it'll be taken twice daily, and then after 8 days, it'll be taken 1 milligram a day, twice daily.
Thanks for letting me know. I didn't know there was prescription medications to help quitting tobacco use.
Yes, there's lots of options out there to help quitting tobacco use. These are just some options that can reduce craving and withdrawal symptoms.
What are the withdrawal symptoms?
Some withdrawal symptoms can be mood swings that can cause things such as anger, being upset, sad, and some restlessness, as well as intense cravings.
Wow, yeah, I think I remember feeling the intense cravings.
Thank you for letting me share that with you, Adrian. There's also other resources available, such as websites. For example, smokefree.gov is just one of many websites that help tobacco use, help quit your tobacco use, as well as talking to your family doctor and booking an appointment with them. That'll also be another great resource for you. There's also a website called Thrive that also offers support groups with people who are also trying to quit tobacco.
Wow, I never knew there were so many resources.
Yes, there's a bunch more, and we could definitely try different ones to see which one works the best for you.
Amazing.
Based on your appointment today, would you be interested in setting a quit date?
Yes, I would be.
What time would be the best for you to set a quit date?
Let's set a quit date for July 31st.
That's amazing. That's very great to hear. Is it okay if I book you in for an appointment at the clinic here 2 weeks from that date, just so we can see your progress and go over any resources or methods that you use to help quit your tobacco use?
Yes, that sounds great. After talking to you, I feel very hopeful I can quit now.
I'm very happy to hear that. I am here to help, and so is everyone here at the clinic. Thanks for coming in today, and I look forward to seeing you and working with you along in this journey. Before you leave, I also am going to give you this brochure along with the fact sheets that you could take home with you today that will also offer other resources to help quit your tobacco use, and you can also look over it at home if you ever have any questions, or if maybe you want to just kind of refresh your brain about everything we talked about today.
Thank you so much.
Thank you so much, Adrian, and thank you for coming in today.
Thank you.